I think one of the big reasons to get your colonoscopy is that colon cancers are asymptomatic, or you don't know you have one until it has progressed to the point that you're either bleeding or obstructed and not passing things through anymore. So with the colonoscopy, we want to find either before it becomes a cancer or as early as possible in its development. The day before, we have you drink a combination of Miralax and Gatorade, and it cleans out your colon, cleans out your system so that we can get the best look at your colonic tissue as possible. The day of, you come in, you get an anesthetic to put you to sleep. Usually takes about 30 minutes, and then you wake up and you go home the same day. Depending on your race, family history, other diseases you may have, it may be earlier. So that's something to talk to your primary care doctor about, when you should get your screening colonoscopy. When you need your next colonoscopy depends on the findings of the first colonoscopy. So if your colonoscopy is normal, the recommendation is 10 years, again based on family history and findings of other colonoscopies. If during your colonoscopy we see polyps or other lesions that we're concerned about, we can biopsy them at the time of your colonoscopy. We send them to the pathologist, they tell us what it is, and then we base your next colonoscopy on that. On your colonoscopy, we may find just normal colonic mucosa. We may find diverticulosis or diverticulum, which is a normal finding in many people. We can find polyps or precancerous growths and remove them at that time. And the real reason you want to get your colonoscopies is to remove the polyps before they would become a cancer, which is another thing we can find on colonoscopy and then plan further treatment from there. A polyp is a precancerous growth. They can vary in size from a couple millimeters to several centimeters. Most colon cancers start from polyps, so we want to do the colonoscopy and remove those polyps before they have a chance to develop into a colon cancer.